Hi, my name is Emily Meyers. I'm a family nurse practitioner, licensed esthetician, and co-owner of Skin Therapeutics. Skin Therapeutics is a med spa in Ellicott City, Maryland. We specialize in medical grade skincare and cosmetic treatments to fit all skincare types and needs. Botulism toxin type A, also known as Botox, is used to relax the muscles to prevent from having contractions, which will also prevent fine lines and wrinkles. It works on the nerve receptors that prevents the muscles from making contractions, which is what is causing us to have wrinkles. We are also using it to prevent from sweating, called hyperhidrosis. Botox is also used for various things such as a lip flip for those who are not wanting to do lip filler quite yet. We use a teeny little bit of Botox around the lip area that just gives the lips a little bit of oomph to look like you've had a teeny bit of filler. It's also used to relax the platysmal bands in the neck to help to tighten up the neck and work with those annoying necklines that we call tech neck, especially from COVID days. It's also used in the trapezius, which will help to elongate the neck area and help to release tension and causing tension headaches. We have various clients that come in here for Botox. We have clients that come in their 20s. We also have clients that come in their 60s or 70s. Nowadays, clients are more aware of what Botox can do. I think there's less of a stigma. We are really using it for prevention, which I really like because you can use small doses, microdosing, which will help to prevent fine lines and wrinkles. So such as the fine lines in the frown area, the forehead, the crow's feet, or any other unwanted areas. Ideal candidates for Botox are number one, those who are not breastfeeding or pregnant, those who are looking for anti-aging such as preventing the fine lines in the frown area, those who are showing existing lines in the frown area, forehead, crow's feet, and also those who are also looking for jaw thinning. We can inject the Botox in the masseter muscles, which are right here on our face to thin the jaw area. So there are various clients who come in, those in their 30s, 40s, 50s, and now even in their 20s, especially for prevention. When you come in for your first appointment for Botox or Dysport, both are neurotoxins that we use here, you will come in for a consultation with one of our highly trained nurses. We like to do the consultation prior to having the appointment because some of the clients that come in are unaware of what they're actually getting done or what Botox or Dysport really does. Sometimes they get confused as to what the neurotoxin does versus the filler. So it's really helpful for us to be able to take that time during a 45-minute consultation to go over exactly what the client needs so we can individualize the treatment. And then after the treatment, if we have time and decide that Botox or Dysport is right for you, we will administer the treatment because it really doesn't take that long. It's mostly doing the evaluation first, or we can have them come back when they are ready to do the treatment. The recovery and aftercare is very simple. It takes generally 5 to 7 days for the product to kick in. Studies have shown that Dysport does kick in faster than Botox, but honestly, it varies from client to client. So I typically tell the client, especially new ones, that I will see you back for your follow-up in 2 weeks. We do like to take a before picture and an after picture to make sure that everything has settled in okay and that the client is happy. I do go over post-care instructions, no exercise for 24 hours post-treatment. You can ice if you need to, but usually it's not necessary. And sometimes because we are injecting a foreign product into the muscle, the first time especially, you can get a slight headache, which will go away. We do advise not to massage the area with your hands, but you are ready to go about your day, make your facial expressions, and wait for it to kick in. Bruising is always a possibility when we're injecting the face or anywhere on the body with needles. Of course, we try very hard to avoid bruising with any of our treatments, but sometimes it's inevitable. So with Botox or Dysport, we do use very teeny tiny needles for administration. So the bruising is usually unlikely. We do have arnica or topical products that we can apply after the treatment to help prevent bruising, but typically with the neurotoxins, it's not as much of a problem. If you are concerned or you are someone that is prone to bruising, there are things that you can do prior to treatment, such as discontinuing any blood thinners, which would be ibuprofen, Advil, aspirin. Fish oil is actually well known to be a big bruiser, about 5 to 7 days prior to treatment. Botox is a very safe procedure. It's been FDA approved since the early 2000s. In fact, Botox has been around since the 1970s. So it is a very safe product. Everything that we use here is FDA approved. The frequency of coming in for your Botox is generally about every 3 to 4 months, but does vary from client to client. So we always have you book your appointment before you leave so you do not forget to come back in. That is very important to continue with the results. As I have mentioned earlier, we do offer both Botox and Dysport. Both are equally great products. We have both because clients respond differently to neurotoxins. So I like to have a variety depending upon what works best for them, which is very individualized. We would love to see you here at Skin Therapeutics for your individualized consultation. We will go over exactly what you need and costs as well. So we look forward to seeing you soon. Please call to book your next appointment.